all the supply out to everybody as soon as possible.
From CJOB, Diana.
Good afternoon, Diana from CJOB. Just a question on kind of the testing numbers and the backlog. I know the positive cases are being notified first, but is there any sort of prioritization with negative results, like our healthcare workers and other first responders getting notified before other people? And kind of what is the backlog on those results right now?
Yeah, I don't think the backlog is very big now. Dynacare has been making, when they first started, 1,200 calls a day. And they also expanded their hours, so they're now working into the weekend to make sure they keep up with the lab. So I don't think the backlog is the problem. I think there are a percentage of people they have been struggling to contact. And so I don't know if those people have changed their phone numbers or they're at work or out somewhere. But if you are one of those people who are expecting a negative result and you haven't heard from Dynacare and it's been a couple of days, then you should call the site where you had the test done or your primary care provider.
And then as a follow-up, you mentioned the COVID case contact center is up and running. How many people are staff getting in touch with on a daily basis, and what kind of capacity does the center have for the work they're doing?
That's a good question. So they're located at Deer Lodge, and there were some Red River community students who came in to help with the surveillance part. And there's also, I believe, 15 medical residents who are working to support the if there's any clinical issues that need to be dealt with. And so they're working together at Deer Lodge. They have physical space where they are separated, physically distanced, and they have capacity to grow as this continues over the weeks and months.
From the Winnipeg Sun, James.
Good afternoon, James from the Winnipeg Sun. Just a quick question. Is our testing strategy evolving based on success and failure in other parts of the world or in other Canadian jurisdictions?
The testing strategy is certainly based on where the highest risk individuals are. So we want to ensure that we're using our capacity to test those that are highest risk. So it's informed. It's informed at the national level. And that's also informed from other jurisdictions. So that is where we tend to move. So certainly we'll, implement testing strategies that are necessary for any unique circumstances here. But for the most part, it's nationally informed. We're looking to test those that are highest risk, and then as our capacity improves, we'll move it down to lower and lower risk individuals.
Thank you.
From CBC Radio Canada, Ezra.
Hi, Ezra Cuisneau from Radio Canada. Please, would it be possible for you to clarify the exact process to declare a previously infected person as ill, please?
Well, how we describe someone as recovered, is that the question?
Exactly. From the time he's sick, from the time he's ill, what is the different steps to the point that, okay, now he's completely out of the blue?
Right. So our definition would be 14 days after the onset of symptoms and symptom-free. And so whichever is the longest of that. So usually by 14 days, people are symptom-free. We would include them as recovered. If after 14 days they still have symptoms, then we would wait for them to be symptom-free for 24 hours and then cover them and then call them recovered.
Thank you. So I understand that there's no other test to confirm that they're they're ill. And also, I just wanted to see, is it the same process in different provinces in Canada? Is it the same process all over our country?
That's correct. Yep. So we're not going to rely on tests. The problem with the PCR test, the molecular test that we run, is that it just detects the genetic material of the virus. It doesn't mean it's a viable virus, that it's infectious. So sometimes that test can be positive for weeks after a person is better. So that's not useful. So studies show with viral culture, which does show that, is that usually even after 7 to 8 days of after onset of symptoms, it's very unlikely they'll be still transmitting that virus. So we in Canada, we put in that safety time. So some provinces use 10 days. We use 14 days for extra safety, but we don't require a test of cure to label somebody as recovered.
From 1029 CHTM, Navi.
Good afternoon, Navi Ball with CHTM. I just want to ask about the proposed facilities, temporary facilities in Thompson, Winnipeg, and Brandon. I was wondering if, specifically for the Thompson facility, if it will be open just to those who are admitted into Thompson General Hospital, or will it also be open to patients in the surrounding community as well, if needed?
So, Navi, are you referring to the RFP that the Premier had mentioned a couple of days ago?
Yes.
Yeah. So my understanding is that is an alternative setting to the hospital. And so it would be for patients who are not requiring acute hospital admission, but for whatever reason, maybe it's too risky for them to go home because of the virus or because of the home setting, or they need some prolonged care, like alternative levels of care. So I believe the RFP went out looking for spaces first. So they're trying to identify where are there large spaces where we can use in the future, and then and outfit it with the beds and whatever supplies we need. So at this point, those details aren't determined. And actually, my goal would be is that we're preparing for it. But if we can manage within the hospital settings, that would be ideal. So that it's kind of a backup plan that we want to have available to us if we need it.
And just wanted to get clarification on the weekend hours for the test site. So will it be Friday to Monday 1 to 5, or will it just be on Saturday and Sunday 1 to 5, and Friday and Monday are still 9 to 4?
The information that I have is Thompson, Flin Flon, the PAW will be open daily throughout the weekend with hours from 1 till 5.
From CBC Manitoba, Bart.
Bart McKee, CBC. Last week you said that this Sergeant Center would be open to deal with disadvantaged people. What's the plan for homeless people right now who are symptomatic, and why is that Sergeant Center not up and running if it is not?
This is 777. Yeah. I think that. That's in the works. I don't know if there is any. I don't believe there's any utilization of it right now, but I think we'll have to follow up. I know that there's a lot of planning that's gone into which does show that is usually even after it was moving forward. So I'll have to clarify whether it's 7 to 8 days if it's up and ready right now or not.
Okay, thanks. Ms. Saragusa, you mentioned that some protective equipment is not getting to all
after onset of symptoms.
What are
it's very unlikely there will be still transmitting that virus. So we in Canada we put in that safety time. So some provinces use 10 days.
Ideally we would get it out to everybody as soon as possible, and that's still our goal.
But we don't require a test of cure
as we deal with these challenges in getting our distribution to us, it will affect what we can distribute
CHTM.
obviously. So
Navi.
it kind of depends. So Canada Goose is now
Good
making
afternoon,
gowns
Navi
for
Ball
us.
with
So yesterday I
CHTM.
identified that as a problem. So that will help as soon as those are ready. And I understand we're going to get them as they come off the line. We have also had some good news about gloves. Minister Friesen advocated very strongly on our behalf of all Manitobans. So we'll be getting a shipment of gloves from the federal government. So as soon as possible, we're going to get everything everyone needs out. We're going to get some things. And remember, we have been ongoing shipping supplies out. So some areas may already have a week or two supplies where they're fine. And so it's really a dynamic. I can't give you specific dates, Bartley, because it's literally changing all the time. And we will get as soon as possible to all groups.
We have time for a few more questions. Anyone have a follow to their follow?
Dr. Wilson, Dr. Keepus here. When someone's on intensive care, does that automatically mean they're in a ventilator? And has anyone survived or recovered from a ventilator or ICU?
Right, so not necessarily. So you can be in the ICU without being on a ventilator. We have 5 that are currently admitted and 4 are currently on a ventilator. I don't believe we have anyone that's listed as recovered that had spent time in the ICU, but there has been a recent step down from the ICU to the ward.
Thank you.
Diana from Security CJOB. I definitely wasn't super clear on my question.
Navi, are you
but
referring to the RFP
like,
that the Premier had mentioned a couple of days ago?
Like in communication with tracing those contacts. Like how many people are they reaching out to? Do you know?
Oh, I see what you're asking about. How many patients are they in contact with? Or contacts and positives. Do you know that answer?
No,
That's a public health.
Yeah, so we're looking at trying to get a detailed assessment done of, say, depending on all the reports we have in of maybe the first 150 cases, and we can try to elaborate on just how many contacts that typically will allude to. So I don't have a list of how many contacts we have right now, because that certainly changes depending on the cases, and new contacts are identified over time. So we are going to try to have a bit more of a detailed assessment that we can share with everyone.
Okay, is there any kind of ballpark? Obviously, I understand it's very, very changing very often.
Well, so typically our contacts, and it has a wide range. If we look in other jurisdictions, and most of ours, they have a range of 2 to 20 contacts per person. So it's a big range, and it's really depends on the individual and the circumstances. So I don't have the exact total that we have here.
Okay, thank you.
Dr. Rusin, Larry.
Go ahead, Larry.
Larry Cush at the Winnipeg Free Press. Dr. Rusin, do you have any breakdowns on the type or age or of patient that winds up in hospital yet? Can you make any generalizations? Are they all with underlying health conditions, or are they a specific age group?
Yeah, so I know that we are trying to work on that to get things for you that are a pretty detailed assessment of our hospital-based clients. I don't think I have those exact numbers with me here. There's some. We have some breakdowns, but we're trying to work on being able to articulate that in to you to list that age breakdown, the percentage of hospital or the underlying medical conditions, hospital stays, those type of things. But I don't have that in front of me.
That's something you expect to have in the next few days or next week?
Yeah, I'd like to have something that we could provide within the week or so.
Thank you.
Stephanie with City News. Just wondering if you can clarify, just so that we're on the same page. Not all frontline health workers right now will get PPE or are not expected to get PPE as the supply dwindles or are currently not getting it? And like which areas are they working in?
So yesterday I identified that in some areas, specific areas, we are short. We were short. That we had maybe a week or two. So yesterday left. I identified that has some changed areas yesterday because we have had gowns come in and gloves come in. So they will continue to be delivered to those who are delivering direct patient care, but they will go out as they are available, and we need to look at a strategy going forward because this supply issue will continue to be on top of us throughout this whole pandemic, and you can see it everywhere. People are making or not making or delivering, or it's delivered but it's not arriving. So yes, it's an ongoing challenge. So as soon as we have equipment available, we will be delivering it to the regions. We'll be working with the regions, and we will make sure that those who are at the most risk are receiving their supplies.
So then the universal principle that I think we discussed last week is no longer in effect, that all healthcare workers will be getting it no matter what.
No, that's not true. The universal PPE is part of a way to conserve, actually, because in the absence of any direction, people are using everything. So this provides clear direction as to what you need when. Not everybody needs a gown all the time. Not everybody needs to change in between. If you're working on a COVID unit, you just put your PPE on and you're good. You just change gloves, but you can maybe wear your mask and your glove or your gown throughout the shift. So, no, it's quite detailed depending on where you work, what the PPE guidelines are. And it would be our goal that be in effect as soon as possible.
We have time for one more question.
Ms. Surrogates of Bartley Kiva at CBC. How many of Winnipeg's 150 public health nurses are working full-time on COVID-19?
I'll ask the public health expert.
Yeah, I don't think I know the proportion of that exactly. I'm sure there's other issues that still need to be dealt with, but certainly COVID-19 is the priority right now. But I don't have an exact breakdown of how many are working just on that.
And that concludes today's media briefing. Thank you.
Thank you.
They call it wrong. They missed the call. They could have called it months earlier. They would have known. And they should have known. And they probably did know. So we'll be looking into that very carefully. And we're going to put a hold on money spent to the WHO. We're going to put a very powerful hold on it.
So is the time to freeze funding to the WHO during a pandemic.
No, maybe not. I mean, I'm not saying I'm going to do it.
you.